It's a privilege to serve under your chairmanship this morning. I'm very pleased that we've got an opportunity today to discuss the record levels of suicide and self-harm in our prisons. The debate we're having is incredibly timely. Yesterday it was announced that prison officers planned to strike today. The reasons they cited were more and more members being assaulted every day, the increase in self-inflicted deaths, and daily security breaches as a result of staff shortfalls and budget cuts. The industrial action has been blocked by the Secretary of State, who won an injunction in the High Court, but the serious concerns raised by the Prison Officers Association cannot be ignored. Yesterday, a report from the Institute for Government declared that spending decisions have pushed prisons, and I quote, beyond breaking point. Our criminal justice system rests on the idea that a person who has committed a crime should be punished, if necessary, and at the last resort, by the removal of their liberty. By removing a criminal's freedom, we seek to protect the public from the criminal's activities for the duration of their time in prison. We also aspire to provide meaningful opportunities for rehabilitation so that on release, the prisoner can rejoin society as a law-abiding citizen. What we do not do in the United Kingdom, and have not done since 1964, is use the removal of a criminal's life as a punishment. Yet within our modern-day prison system, an all-time record number of prisoners are paying for their crimes with their lives. Official data published by the Ministry of Justice on the 26th of January this year showed that 119 prisoners died by suicide during 2016, and this was the highest number in a calendar year since current recording practices began in 1978. The charity inquest, which monitors deaths in prisons, have reported that already there have been 8 recorded self-inflicted deaths in 2017, with a further 7 deaths awaiting classification. On average, Mr. Chairman, a prisoner dies by suicide every 3 days, and 12 women lost their lives through suicide in 2016. Well, the Minister might be tempted this morning to say that this increase in deaths by suicide is a reflection of the increase in the prison population as a whole. But that argument doesn't stack up when we look at the figures. The number of deaths by suicide has doubled in just 5 years. Yet the size of the prison population, currently standing at a little over 85,000, has plainly not doubled since 2010. The Minister might be further tempted to suggest that a prisoner who takes their own life in prison may well have done the same on the outside. But the likelihood of a self-inflicted death in prison is 8.6 times more likely than in the general population, according to the Howard League for Penal Reform, and I'll take the intervention.
Thank the Honourable Lady for giving way and congratulate her on bringing this debate, and it's a very important debate, and she's making some excellent points, which I hope to hear a reply to later. But would you agree with me that if there was a suicide in a hospital, that would be a very serious issue, and it should be taken no less seriously in prison, and there is action, urgent action needed to required to reduce suicides that do take place on prison premises?
Well, I thank the Honourable Member for his intervention and for his commitment to this issue around mental health. I don't believe that deaths in prison should be treated any differently to deaths in any other setting. And it's very clear, whether it's the issue around ligature points, for example, that are contended with very differently in inpatient settings compared to prison, that there's many things that we can point to that should be treated in the same way as they are in any other element of life outside of prison. The number of self-harm incidents, Mr. Chope, has also reached a record high of 37,784, up nearly 7,000 on the previous year. And one group in particular that has been uniquely failed by the prison system is transgendered prisoners. There have been 4 deaths by suicide of transgender people whilst in prison over a mere matter of months, and that's from an estimated prison population of just 85. We know that prevalence of mental health conditions is much higher amongst the prison population. Prisoners are over 3 times more likely to suffer from depression, 12 times more likely to suffer from a personality disorder, and 16 times more likely to suffer from psychosis. For those prisoners who need to be treated in the mental health inpatient unit, departmental guidance says that transfers under the Mental Health Act should take place within 14 days. In the answer to my written parliamentary question, I was appalled to learn that in 2015-16, 1,141 prisoners, that's 3 in 4, waited longer than this 2-week window. And this ubiquitous failure would never be tolerated in the outside world. With regards to data on mental health in prisons, it feels like a minefield trying to get hold of figures which give a true representation of the scale of the problems. And I can't help but feel that the Minister and his department are trying to pull the wool over our eyes. When I resubmitted the question to get the most up-to-date figures, I was told that in the space of just a few months, the data is now, and I quote, not held in the requested format, despite the wording of my question being identical. And I hope the Minister today could please tell me why the collection of this data has now changed. At the time of finishing my speech, shortly before we began this morning, his department's answers to 4 of my named day questions were very long overdue. And these answers would have played a key part in my contribution, but regretfully, I cannot hold the government to account fully on them today. Just one example was a question I asked about what proportion of people who died by suicide in prisons was not on the ACT pathway, the Assessment, Care and Custody and Teamwork pathway, for people who have been identified as being at risk. In 2015, only 35 of 89 people who died by suicide were on this ACT pathway, suggesting that too many vulnerable inmates are not being identified early enough. I asked the question again on the 31st of January, over a month ago, and his department has still not come back to me with this vital information. Prisons should offer a unique opportunity to provide mental health treatment in a secure environment, but I believe this government is betraying those vulnerable people our criminal justice system is supposed to protect. I've met with representatives from the Prison Officers Association who told me that despite having worked in the prison service for decades, have not received any mental health training ever. A recent Royal College of Psychiatrists forensic faculty survey found that service cuts mean that most prison psychiatrists don't feel able to deliver, and I quote, a basic level of care. It's clear that the mental health services in our prisons are buckling, and on a recent visit that I made to a local prison, I saw firsthand the lack of care and the lack of services available to inmates in that prison. A recent consultation carried out by the Centre for Mental Health found that a decrease in prison staff meant that inmates often missed psychiatric appointments because there was no one available to escort them, and consequently they couldn't get the treatment that they needed. This is the stark reality that decimating staff levels in prisons has created. We know that there are 7,000 fewer prison officers than when this government came to power, or the coalition came to power back in 2010. The impact of these drastic cuts are not trivial. Our prison services are out of control. We know that assaults in prisons have risen by a third in the 12 months to September 2016, the highest on record. There's been a wave of prison riots in the final weeks of last year, including at Birmingham, Bedford, Swaleside and Lewis. And the inconvenient truth of the Minister is that as things stand at the moment, he cannot guarantee the security of anyone who sets foot in our prisons. Her Majesty's Inspectorate of Prisons has found that an increasing number of prisoners are reporting feeling unsafe in our prisons. And only yesterday, we heard the conclusions drawn from an unannounced inspection of HMP Featherstone, and we heard that some prisoners felt so unsafe in the prison, they resorted to self-isolation, asking to be locked up for nearly 24 hours a day, and in some instances, this had lasted for months. Nationally, there's been a significant increase in the ratio of prisoners to prison staff, and it's not only prisoners who don't feel safe, but hard-working staff who brave the front line every day, aware there might simply not be anyone there to back them up if an incident becomes unmanageable. A couple of weeks ago, BBC's Panorama aired an undercover investigation which was filmed inside HMP Northumberland, and I'm sure anyone who watched it, like me, would have been and was appalled to see the truth about prison life laid bare: pervasive violence, widespread drug use, security systems which aren't fit for purpose. Put simply, Mr. Chope, chaos. During the course of this debate, it's important to remember that part of the reason this dire situation has arisen is because far too many people have been inappropriately put in prison when they should have been receiving mental health treatment in a secure inpatient unit. And there's a real need to address how the courts treat people with mental health problems, and particularly what happens around community sentences, and including mental health treatment requirements within those. Mr. Chairman, I was compelled to secure this debate because of one case in particular. I should add, and I didn't mention at the start of this debate, that I've been raising questions about suicide and self-harm in our prisons for many years now, but I was compelled to put in this request following the tragic story of Dean Saunders. And Dean Saunders was just 25 years old when he died by his own hand at Chelmsford Prison in Essex last year. I had the privilege of meeting Dean's parents, Mark and Donna, and I heard in their own words about this tragic case. Dean was suffering from severe mental illness, and he'd harmed both himself and his brother and father as they tried to help him during a paranoid episode. He was charged with attempted murder and sent to prison, but his family were told that there he would be safe. The inquest jury unanimously concluded that Care UK, the private company that ran healthcare at the prison, treated, and I quote, financial considerations as a significant reason behind the decision to downgrade him from constant watch to half-hourly observations, despite several warnings that he might harm himself. It said there were multiple failings, including a complacent approach to Dean's mental health. The jury found an assessment of his mental health needs was, and I quote, not adequately conducted. They concluded that the cause of death was, and I quote, contributed to by neglect. The system failed because of financial cuts in the prison budget, and Mr. Saunders paid for it with his life. And despite this damning verdict, Care UK continues to provide healthcare, including mental health services, to over 22,000 prisoners in the UK and many prisons across our country. I know that the Justice Secretary has now met with Mr. Saunders' family, and I welcome that. But Mr. Saunders presented a high risk of suicide. He should never have been in a prison in the first place. He needed specialist treatment in a secure mental health facility to protect himself, but none was made available, and I give way.
I thank the Honourable Lady for giving way again. Would you agree one of the problems here may well be that people are either siloed into either being either under the care of forensic psychiatry or put into the prison system? And there's very little and there's very poor interaction between the general mental health system and what goes on in prison, particularly in terms of discharge when people leave prison, and in terms of actually helping those people to receive the adequate care in the community they need when they leave prison.
Well, I thank the Honourable Member for his interventions, and there have been many reports and inquiries and recommendations which highlight the very point which he has made this morning, reports that date back to 10 years ago, in fact. And actually, I would hope that in the Minister's response, he will reflect on all those reports and inquiries and recommendations that have already been put forward to actually outline today what he's going to do to ensure that current separation is adequately addressed, so we have no situations like we have in this very specific case. I wanted to essentially say to the Minister that the question now is what a Minister is going to do to ensure a similar situation of what happened to Dean never happens again. Because this shocking and shameful rise in suicide and self-harm is happening on this government's watch. And I believe that the Minister today must outline his plan of action. Because these are not statistics, Mr. Chope, they are real human beings. They are somebody's father, somebody's mother, somebody's daughter, somebody's son. And the government cannot get away with sweeping this issue under the carpet for a second longer. I should have said also, Mr. Chope, that I note that the Joint Committee for Human Rights is also conducting an inquiry on this very specific issue. But I hope today might be a precursor to the outcomes of that inquiry. Last month in Justice Questions, I raised Mr. Saunders' case, and the Parliamentary Under-Secretary of State for Justice told me that he was, and I quote, seeking the details of all those cases to see whether there is a pattern in why they are happening. He told me that he hoped to come forward later in the year with suggestions for policy change relating to mental health assessments in prisons. I would assert that an assessment in and of itself is not enough, but however, when I sought more details in a written parliamentary question, the Secretary of State's answer exposed a U-turn on any plans for such an investigation. And while another exploration of data would have been wholly inadequate, it would at least have been something. Now it seems the government has no plans in place to confront this crisis. I would say to the Minister, if he thinks a further review of the evidence is needed, I'm here to disabuse him. If he thinks we need more consultation, I am afraid he's mistaken. There have been countless inquiries and reports that have already been conducted, which have a plethora of very practical recommendations to their name. In particular, we've got the review carried out by Baroness Corston of women and significantly the Harris Review on self-inflicted deaths of young people, which was the most comprehensive review of suicides in prison and heard directly from bereaved families. There was very many important recommendations on learning and accountability that were put forward, but have so far been rejected. And families tell us time and time again that they want from a tragedy, what they want from a tragedy like this is for no one else to go through a similar experience and for actual concrete changes to be made. Ultimately, we're seeing these same failings repeated time and time again with this pattern of preventable deaths. And currently, there is a very significant accountability gap. I think that deeds, not words, are what are needed now, and a concrete plan of action is necessary, not yet another ministerial speech. And I say that for the memory of all those who have died by suicide in our prisons. I do think it's unacceptable. We abolished the death penalty half a century ago, and that was for very good reason. Now we must ensure that in 2017, no prisoner pays the penalty of their life because of the failure in our prison system. And I look forward to the Minister's response.
Dan Geemer.
Mr. Chair, can I say how pleased I am to serve under your chairmanship, and I congratulate the Honourable Member, the Member for Liverpool Wavertree, for securing today's debate, and I thank the Member for South Suffolk for his insightful interventions. I would also like to extend my particular thanks and welcome to Mark Saunders, father of Dean Saunders, who tragically died by his own hand in Chelmsford Prison, for joining us for today's debate, and reiterate the point that the Secretary of State and I made to him when we met, that I very much look forward to working with him to bring in some real solutions to the challenge of suicides in our prisons. Welcome, Mark. Like the Honourable Lady, I am very concerned that the rates of suicide and self-harm in our prisons are too high. This is an issue that transcends our political parties, despite maybe I'll say our different perspectives sometimes on the reforms needed in our prisons. My priority as Prisons Minister is to provide leadership and drive improvement across the system to bring those rates down. As honourable members will recognise, some of the problems in our prisons have long roots. It will take time to refocus the system on rehabilitation and reform, but as the last set of statistics for levels of suicide and self-harm reaffirm, we must also take urgent and decisive action to make prisons places of safety for those prisoners who are themselves at risk. The challenge of record levels of suicide and self-harm in prisons is a complex one, and there is no simple solution. We know that prisoners are a high-risk population, and many of them come into prison with drug or alcohol problems, isolation, social disadvantage, sometimes experience of sexual or physical abuse, and mental health problems. All of these factors increase the risk of self-harm or suicide amongst prisoners. We also acknowledge that the nature of the custodial experience can further increase these risks. But this should not serve as an excuse. I'll take that intervention.
I'm grateful to the Minister for giving way. I'm encouraged by what he's saying. I just wondered if he's aware of figures from De Montfort University that show that 46% of women in custody have previously attempted suicide, and that women in the criminal justice system on average die 16 years younger than their counterparts who aren't. And if he will acknowledge that this is part of an ongoing dialogue that's needed between mental health and the criminal justice system.
Order. I did say to the Honourable Lady earlier that interventions from opposition spokespersons are not allowed in a short adjournment debate. And I just reconfirm that that's the ruling, so I'm not going to allow the Minister to respond to that intervention, and I apologise to the proposer of this debate for this interruption.
Mr. Chair, any loss of life in our prison, whether it's for a male or female prisoner, is tragic, and I would hope that the comments that I'm making address the issues in female prisons as well as male prisons. Deaths in the early days in weeks of custody are highest after reception, sentencing, transfer or recall. There are also significant numbers of deaths among lifers and other prisoners late into long sentences. We are developing a package of reforms as part of the Prison Safety and Reform Programme, and will be consulting a range of external stakeholders to seek their views on the action that will be taken to address the complex issues of suicide and self-harm in prisons. And on that note, I know the member for Liverpool Wavertree asked for, in a written question, about the internal review. I'd like to reassure her that there is an inquiry underway looking at all deaths in custody in the last year to further our understanding of why these events are happening, and she'll certainly know what the results of that inquiry are as soon as they are available. But looking at how we address this, as I said, the early days in custody are particularly critical, and we're taking early steps to make sure that when somebody enters a prison, they are given the support they need at this important time. We're rolling out new training courses across the estate to support our staff to identify risks and triggers of suicide and self-harm and understand what they can do to support prisoners at risk. This involves awareness training for prison staff on supporting prisoners with mental health issues. The new package consists of 6 sections that can be delivered to both new and existing staff, either in succession to each other or in modular form. The full, yes.
Thank my honourable friend for giving way and for the answers he's giving to the debate. But just to clarify, is that training going to be compulsory for prison officers, or is it going to be voluntary or according to the amount of funding that's available?
Minister.
Well, we're making it available to all prisons, and we would expect prison governors who are in charge of this to make sure that as many of their staff as possible can take this training, and particularly those who are operating on wings and have direct contact with prison officers. And the full training package, just to give a sense of how important it is, will take about 1.5 days to complete. We are also making improvements. I would like to make some progress in developing our points and maybe come to intervention later. We're also making improvements to the assessment, care in custody and teamwork process. And this is the case management process in place in our prisons to support and manage prisoners at risk, to identify opportunities to make it more effective. This includes changes to relevant training and developing a new self-harm diagnostic tool for use by prison governors and staff, which brings together information for each prison about numbers and types of incident and where in the prison they are happening. But also we're improving the infrastructure and partnerships. To support governors and prison staff across the estate, we have put in place specialist roles, regional safer custody leads in every region to provide advice to prisons and to spread good practice on identifying and supporting prisoners at risk. We are also committed to developing partnerships with others who can help us. In addition to the funding already provided to support the Prisoner Listener Scheme, we will be providing extra funding for the Samaritans to provide targeted support for prison staff and to prisoners directly, including by piloting emotional resilience, training for new prisoners delivered by released ex-listeners. In the immediate term, a National Learning Day will be held on the 14th of March for prison staff on suicide and self-harm. We also strive to continue to learn from others and from completed and ongoing reviews. The Independent Advisory Panel's ongoing review of self-inflicted deaths of women will be critical for us to respond to. We continue to benefit from individual reviews into deaths in custody by the Prisons and Probation Ombudsman. As honourable members will have seen, we have now introduced the Prisons and Courts Bill, which contains measures to put the Ombudsman on a statutory footing with powers of entry and requirements on the Secretary of State to publish responses to its reports. Mr. Chub, this will give the Ombudsman real teeth, and certainly the reports of the Ombudsman real teeth, and also an imperative in the system to follow through the recommendations and make sure that they are implemented. This gives effect to a long-standing commitment by successive governments to give the Ombudsman a permanent status, which I hope honourable members will welcome and support as the bill progresses through the House. We will also redouble our efforts to support the protective and environmental factors, which evidence tells us reduces risk. We know that strengthening family ties and peer support can support prisoners' well-being and make custody safer. Governors will be held to account for the family services in their prison, and from autumn 2017, the family service budgets will be devolved to governors so that they have the flexibility of how they resource family services to best meet the needs of their prisoners. We are also supporting digital developments in prisons, including the rollout of in-cell telephony to enable prisoners to call their families more easily at cheaper rates. We will learn from Lord Farmer's review to investigate how supporting prisoners to engage with their families can support their rehabilitation and provide encouragement. I can see the Honourable Member is itching to make an intervention, so I'll give way.
I thank the Minister for very kindly giving way. If I can just bring him back, because I can see that he's about to conclude and we still have a few minutes left of the debate. If I can bring him back to 2 points. One about the training that may or may not be available to prison staff. If I can just urge him to reflect on the fact that there are people serving in our prison service that have done so for decades, that have never received any mental health treatment, and I would put forward that it's important that every single one of them receives the mental health training that he refers to. If he can respond to that, and just if I can just add to it, his point about reducing risk. Is his department looking at how he might be reducing risk in prisons in the same way that we reduce risk from ligature points in mental health settings?
Well, in response to the 2 questions, the answer to the second part of the question, reducing risk in prisons in terms of the fabric of cells, etc., absolutely yes. In terms of the training and opportunities for prison officers to become better skilled and able to identify suicide risk, but also deal with mental health issues. In addition to this training, the Honourable Member will be aware that last week we announced a promotion for all Band 3 officers who can get promoted to Band 4 or get an additional salary at Band 4 if they specialise in certain roles in prison. And one of those is specifically around safer custody. So a prison officer today can choose to specialise as a safer custody officer and get paid more to do so. And 2,000 prison officers across the country could potentially benefit from this increase in pay, as well as the training that I have outlined already. In the light, Mr. Chair, in the light of the disproportionate number of self-harm incidents amongst female prisoners, we are exploring ways for improving family links, including overnight visits, family days, child-centered visits, homework clubs, and the delivery of relationship and parenting programs. We're also taking account of evidence which shows that prison environments have a direct impact on prisoners' well-being and rehabilitation, as the Honourable Member from Wavertree rightly pointed out. Our plans for estate transformation include ensuring that prison sites are configured to support prisoners' access to fresh air, exercise, and meaningful activity. But fundamental to supporting this activity and improving the safety of all those living and working in our prisons will be the recruitment of an additional 2,500 frontline staff that we are funding. Extra staff will enable prison officers to conduct new ways of working and transform the culture in our prisons so that every prison officer is responsible for the supervision and support of about 6 prisoners. And Mr. Chob, the evidence for this model of 1 to 6 is based on, in part based on the work by Lord Toby Harris into self-inflicted deaths, particularly focusing on the youth estate. And that is why we're introducing this important key worker role. I'll take that intervention.
Minister, very, very kindly giving way again as he comes to the conclusion of his speech, but will he accept the fact that this is not additional staff, but merely a replacement of the staff that have already been cut? We've lost over 7,000 prison officers since 2010, and we only have to look at the outcome of that inspection yesterday at Northumberland Prison to know that actually there's a very significant issue of prisoners currently feeling so unsafe that they don't feel able to leave their cells.
Minister.
The 2,500 staff is additional to what we have here. So at the end of 2018, we will have 2,500 additional officers. The baseline comparing to 2010 is not accurate because, yes, we lost 7,000 prison officers, but we closed down 18 prisons. So we're looking at a completely new baseline. But the most important thing here is the one-to-one support from a dedicated officer at the heart of our prison reforms, making sure that prisoners first and foremost are safe to benefit from the help they need to quit drugs, participate in education and skills programs, and acquire the skills they need to prepare for life after release. The Honourable Member also asked the question around the 75% of prisoners, she alleged, that face delays in being transferred to NHS hospitals, not meeting the 14-day deadline. This is obviously a serious concern, and I will work closely with the Department for Health partners and to look into this. Health partners are obviously important in supporting prisoners and meeting both their physical and mental health needs. In 2015, just to put the statistic out there, there were 1,010 transfer admissions to secure hospitals from prison. But I admit that there is a lot more that needs to be done. I read the inquest report into the death of Dean Saunders, and which are incredibly tragic. And I have to say that, like the Honourable Member, I do agree that we are a long way short of where we should be in terms of preventing self-inflicted deaths like this. The points that I've enumerated today show what we're doing now, but we'll be coming forward with even more detail and further reforms to make sure that we bring these deaths down as much as we possibly can. And I look forward to working with the Honourable Member. I'll be willing to discuss these with her in some detail, but also the Saunders family, and of course there are a number of other families who have lost lives in this way.
The sitting is suspended until 2:30.